is your stem.
Okay, ma'am.
Okay, so if you've read and understood considering it clinical examination station, please begin.
Okay. After entering into the exam hall, I will first start with hand washing. Hello, I'm Dr. Reshita. I'm one of the exam candidates here. Can I
Yes,
confirm
hello.
your name and details?
I'm Tom, 56 years old.
Nice to meet you, Mr. Tom. Today I've been asked to examine your tummy, which will include me looking, feeling, and listening to your abdomen and examining your other parts as well. Is that okay with you?
Yes, yes.
Okay. Can you let me know? Do you have any pain in your tummy right now?
Yes, yes.
Can you point me exactly the site of your pain?
Yes, here underneath these dressings that they have done.
Okay, I'm so sorry. I can understand your distress. Um, uh, Now, I will need to uncover your tummy to examine. Is that okay with you?
Okay.
Okay. I'm starting with having a close look to your tummy. First, I will look into the dressing and I will seek permission from the examiner if I can remove the dressing.
No, consider. Leave it. Yes.
Okay. And I will observe if there is any distension of the abdomen from front and from sides as well, and if there is any redness or any visible erythema around the dressing area. And then I will ask the patient, can I, now I need to feel your tummy and I'm assuring you, I will be very gentle with it. And if you feel any kind of pain, just let me know.
Okay.
Okay, I'm starting my light palpation, superficial palpation. And after that, patient
Please
will
explain from where would you start?
From the I will palpate the all 9 quadrants and I will start from the opposite to the side of her pain.
So, right inguinal
On
fossa.
the right iliac fossa, the
Yes.
patient will feel pain.
Okay. So from here you'll start because this was done.
This
Yes.
patient is a critically
What
ill
happens
patient.
then?
Stopping it right, stopping the examination right here, and I'm going to manage, assess and as well manage the patient according to CRISP protocol by going to, with ABCD approach.
So you'll inform the examiner right away.
Yeah. Can I proceed?
Yes.
Okay. Mr. Tom, can you please open your mouth and stick your tongue out?
Okay. Done. Continue,
Can you
please.
stick your tongue up to see
Yes.
the undersurface? Okay, thank you. Now I'm going to look at your chest, and I'm going to feel your chest. Is that okay?
Okay. Continue.
Okay, I will assess the chest wall movement equal on both sides or not. And now I'm going to feel your windpipe. Is that
Okay.
okay?
Yes.
Okay, I will see the trachea position, and then now I'm going to tap your chest. If you feel any, if you are uncomfortable, just let me know. Okay, I will percuss the chest from anterior side, anterior aspect, and then now I'm going to listen to your lungs with the stethoscope. I will check all the both sides from the front. Now, would you please sit down for me? Now, I will check from the lateral and posterior aspect as well. If the patient is comfortable. Otherwise, I will not ask the patient to sit down. And now I will ask the patient ask permission as now I'm going to pull your lower eyelid down to see anemia, and then I will now I'm going to look at your neck area. Would you please would you please look at your left side? Then I'm going to listen to your heart sounds. Then I will check all the four area for the heart sounds with the stethoscope, and then I will, as patient is communicating, I will assume patient is well alert, and I will, if patient has any swelling or swelling in his cuff, in her cuff muscle or cuff area, leg, then I will ask patient, now I'm going to feel your legs. Is that okay? If you feel any pain, just let me know. Then I will squeeze the calf muscle. And if there is any tears, I will remove it with patient's permission. And now I will thank the patient. Thank you so much for cooperating. Covering you up. And I will
Okay,
wash
please
my hands.
summarize your examination, please.
Mr. Tom, 56 years old, male patient. I've examined him, and patient has pain in his right iliac fossa following right hemicolectomy. And today, on 6th postoperative day, I examined his abdomen and found patient is critically ill. And then I proceeded with CRISP protocol with ABCD approach. I found patient is mild dehydrated, and I found I found a patient's airway is patent as patient was communicating, and on checking the breathing, I found his air entry equal on both sides, as well as centrally placed trachea, and no sign of central cyanosis was present, and patient was mildly dehydrated, and patient have no engorged neck veins, and patient's heart sounds were normal. And a patient is well alert. Patient has no pain in his calf muscle. And if time would have allowed, I would complete my examination by reviewing patient's charts and reports and patient's file. To
Okay,
check
what is your provisional diagnosis of this condition, this patient?
Patient, as is a patient, post-operative patient following right hemicolectomy, patient may have anastomotic leakage.
Okay, this is one provisional
Yes.
diagnosis. So how would you manage this patient further?
To manage this patient, I will first keep the patient nothing by mouth, and I will insert an NG tube for suction and for resting the bowel, and I will put an urinary catheter to monitor the urine output, and I will refer the patient to HDU to insert a CV line and resuscitate patient with crystalloid fluid, and I will give IV antibiotic according to trust guideline, and I will send arterial blood gas analysis and urine electrolyte and other blood labs. I will do a chest X-ray and CT pulmonary angiography to exclude any pulmonary embolism, and I will do an ultrasonography to see if there is any collection inside her abdomen. And I can do a CT. I can go for a colonoscopy with gastrography to see if there is an anastomotic leakage. And if anastomotic leakage is confirmed, I will go for laparotomy.
Okay, what is the role of examining the cough of the patient? Especially when in your mind it is that it could be an anastomotic leak.
Cuff muscle squeezing is I wanted to exclude pulmonary embolism or
Why?
any DVT.
Yes. Why in this particular patient?
Because patient is
Does it
immobilized.
have any role?
Sorry, ma'am.
You have to think and tell me because it's your exam. If you'll just memorize everything without even thinking, then you are not being honest to your own self.
Okay.
So you have to think, is there any role or not?
Yeah, I want to exclude deep venous thrombosis.
Could there be, okay, what is all right, 6 days, you could say, is the patient bedridden?
Yes, patient might have pulmonary embolism from DVT.
Okay, what are the things that one should see when, as soon as you convert it to CRISP protocol, you realized patient was talking to you, so you checked the airway. How would you consider airway?
Airway, if patient is talking to me, I
And
asked
telling you that I'm
his name
so
and
much
age.
pain. All right, so right. Then you moved on to breathing. What have you seen in breathing? Have you is there any tick marks? Is there any checkpoints in your mind that you ticked when you were doing the examination that, okay, now I've converted my abdominal examination into CRISP protocol and these are the things, tick, 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 I have to check in airway and now in breathing, now then in circulation, then in disability, then in exposure. So
Yes.
is there anything?
For breathing, I've covered central cyanosis. All the respiratory examination part, inspection, palpation, percussion, and auscultation.
Okay, we'll discuss this.